Hi everyone and welcome to the Hapi podcast, Healthcare and Pharmaceutical Insights. Series 2 is all about a day in the life of. I'm looking forward to spending time with a variety of different people in the healthcare and pharmaceutical industry, discussing what it is that they do on a daily basis. So sit back, relax and enjoy. Welcome back everyone to another episode in Hapi, and we're continuing this series of A Day in the Life of, and I'm delighted to be joined by Emmerline. Emmerline's going to give me a quick introduction in terms of who she is and what she does, and that'll give everybody a fuller understanding on or what our job, A Day in the Life of title is today. So welcome Emmerline, great to see you. Thank you for giving me time of your busy schedule. Do you want to give us a bit of an introduction for us, please?
Yeah, I can do, and thank you for inviting me. My name's Emmerline Irving, and I am the Head of Improving Population Health for the West Yorkshire Improving Population Health Programme, which is part of what's now known as an Integrated Care Board for West Yorkshire, but also the wider West Yorkshire Health and Care Partnership. My role is to work with the team within Improving Population Health to do basically what it says on the tin, and that's look for different ways to improve the outcomes for our population so that they can live their longest, healthiest, happiest lives for as long as possible, free from harm and ill health, and to support our population where they have health conditions and long-term health conditions to live as well as they possibly can.
Good. Lovely, good. This is a slightly different angle for our podcast here, because a lot of the guests I've had on the Hapi podcast have come from industry. Predominantly come from industry, either a pharma company, a med tech company, or whatever. So we're actually going slightly inside a little bit this time within the NHS. It's really good to get a slightly different viewpoint. We'll talk about kind of partnership with pharma as well. So thank you for that. So that intro. So you mentioned ICB, the 3 letters ICB. So people who are in the pharma industry, some will be more familiar with what that means than others. So what is an ICB?
So the Integrated Care Boards are new organisations that were legalised last summer, July. Previous to that, so the previous 5 or 6 years, they were established as sustainable transformation partnerships and plans. Then they moved on to become integrated care partnerships or integrated care systems. And basically, it was the opportunity to look at how we work together across health and social care and local authorities and the rest of the system in order to provide the best health outcomes for our population. What we know is that only 10% of what happens to you around your health happens in a hospital or healthcare setting. And actually the rest of it's determined by the environment that you live in, the services that you access around housing, transport, all of that. So ultimately what the Integrated Care Board in West Yorkshire strives to do is bring all those partners together to look at how we can support the determinants of health, as well as how we then support people in our health and care services. So the Integrated Care Board is the legal function now for NHS England, and we've got different legal requirements as a result of that, and we've got different programmes of work that we have to take forward. An example of that in my programme would be the long-term plan and the work around tobacco and tobacco services within hospitals, and the work around the digital weight management programme. Other examples in my programme is the work around health inequalities and the Core 20+5 funding that's come to ICBs from NHS England. Beyond that, integrated care boards again work with their population. We work on primacy of place. So West Yorkshire's Integrated Care Board is made up of Bradford, Leeds, Wakefield, Calderdale and Kirklees. And those 5 places all have their own integrated partnerships at place level where they work across their own systems. So we use 3 sort of test questions when we do work at a system level. One is, does it add value to place? Can we share learning? Can we accelerate and replicate what's happening in one place across the system? If it's a wicked issue that everybody's struggling with, does it make more sense for us to come collectively together at system level to look at that? or if it's something where it makes sense resource-wise to work together once across the whole system. If it doesn't fit those 3 questions, it's always primacy of place.
Okay. Okay.
So the Integrated Care Board is responsible for many different services, and has, recently taken on responsibility for dental care from NHS England.
Okay.
And we've got all sorts of different programs working across the whole health and care system.
Good. Now, we haven't actually necessarily got this question strictly in, but it is a summary of what we're looking at in terms of what a day in the life of. Is there a standard day in your diary, or is every? I'm guessing. I'm guessing no from your from your laugh. So is there a pretty? Is your week changing every day? Does it? Is that what tends to happen?
Yeah, and I suppose the standard thing is that it always changes. And that's the standard. But it's what attracts me to this role. It's why I love it.
I was going to say you like
Um,
that then, yeah, yeah.
yeah,
Yeah.
yeah. And I've got a very varied portfolio of work, from managing the long-term plan to the adversity trauma and resilience work to managing the obesity work across West Yorkshire. So one day I could be in HMP Leeds, the next day I could be sat around a directors meeting, or um, delivering training somewhere. So it's very
Right.
varied across the patch, yeah.
Yeah. Okay. Okay. So that obviously that is something that you enjoy, and you
Yeah,
don't seem to be the kind of person that can come in and just do the same job every single
I'd be
day.
very bored.
That's not for you. So what motivated you to personally to move into public health? I mean, you've touched on a couple of things here just now, but what motivated you to move into public health?
It was an accident, to be honest. I'm guessing,
Okay.
like many people. I aspired to be a doctor when I was little, but never good
Right.
enough at science. And then my mum got heavily involved in politics and was an elected member for most of my childhood and teenage years. And I ended up doing a politics degree
All
and
right.
wanting to go down
Was
that
she an
route.
MP?
She was a local councillor.
Local councillor, right? Okay. Okay.
Yeah, yeah. And so I did a politics degree, and then decided that there's no way I'd ever be an MP, because I'd never get into the cabinet because I'm too vocal, let's say. I wouldn't always toe the party line. So I decided to head down the research route, and got a job as a research and information officer, which happened to be in Bradford Youth Service, and I didn't realise at the time. And so then I requalified and did a postgraduate and requalified as a youth and community worker, and did that for 12 years and loved every minute of it. And my work was predominantly around health. It was predominantly around health harming behaviours, health promotion, and supporting young people to live their best lives, and bridging the gap between services and young people, and then being able to access services appropriately, and without judgment. And the more and more I did that, the more I thought, well, I actually quite like this public health thing. Maybe I'll go back and learn a bit more about that. So I did. And I went and did a master's in public health, which then brought me into the public health world. And that's how I landed here.
Ah, good.
And I always say that actually it was meant to be, because it's political, it's helping people around health. And it's doing something that I love, and that's being able to advocate for people. So
Mhm.
yeah, I think it was meant to be in the end.
That's a really key thing you said. You're doing something that you love, and if you can do something that you love that pays the bills, and that you have that. Sometimes I think we use the word passion sometimes, a bit flippantly. But
Hmm.
if you are involved in something that you love, and that is you are passionate about, then it doesn't become a job. It doesn't become
Yeah.
work. It just becomes that is what you do. So hats off to you. That's a really interesting journey in terms of where you are and how you reached where you've reached at the moment. So in terms of we touched on at the start about partnership with the
Mm.
pharma industry, and obviously I'm heavily involved in the pharma industry and speaking to pharmaceutical companies day in, day out. So how do you work in partnership with predominantly the pharma industry, maybe also within healthcare, medtech as well?
Yeah, I mean, it depends on the role within the NHS as to where you are when it comes to partnerships with providers, I suppose is how we class it.
Mhm.
And obviously there's always that line between what can we do with partners and what can't we do in relation to commissioning and all the different governance
Yeah.
that we have to abide to. Throughout my career, I've had different relationships with pharma in particular. So I used to commission sexual health services in public health in Kirklees, and I worked quite a lot with pharma, particularly around training clinicians for long-term contraceptive application and things like that. And they would support us to run our training sessions and help us be able to provide the necessary information and, I guess, clinical practice that we needed our practitioners to undertake in order to be able to run the service. More recently, I guess my relationship with pharma is around the new drug that's coming down around Wegovy for the obesity work. And obviously, what I do is I don't work directly with a pharma company. I work with our pharmacy's lead.
Okay.
So we have a pharmacy lead within the ICP, and every place will have their own pharmacy lead, and we've got a pharmacy committee across the region. And I work directly with them through our planned care programme. And so there's lots of work then that goes on that we have to consider around how people will access the drugs and et cetera, once they come into the system. And then, of course, there is also the question around cost and being able to afford to provide the drugs as we need to, because what we find is there's lots of inequalities in that. So my role predominantly in the Wegovy will be very much looking at, when we've got to prioritise who can access that drug, how do we do that through an inequalities lens?
Okay.
And actually, I was just recently at NHS Confed, and there's lots of pharma companies that are part of the exhibits, and I was single-handedly going around them all and talking to them about inequalities and how they can start thinking about inequalities in the production of drugs and the support that they provide to the health and care system.
I love that. I mean, that's and a few of the conversations I've had with people in pharma who are working in partnership with the NHS. That's one of the key things. It's not for pharma to basically dictate to you what what necessarily what not necessarily what should be prescribed, but how things should be worked, etc. Is I'm a real great believer in. And a lot of the guys have said this, is coming to you and saying, right, what's your views on this? You tell us what you're looking for. Maybe that's not the right way of phrasing it, but you tell us, maybe your concerns. Tell us what's going on there just now. It's really important to be for pharma, I think, to be understanding from you. What's happening. What are the discussions that are going on that pharma companies are not able to hear, and how can we solve those problems?
Yeah.
Would you say that that's a really key aspect of your partnership with pharma?
I think so. I mean, because I don't commission pharma per se.
Yeah.
That would be
Yeah.
done through our planned care or our medicines management teams. So my relationship with pharma would be about understanding how we could have that mutually beneficial relationship around how we reduce inequalities and how we provide the best opportunities of access to drugs for our population. And yeah, and looking at the ethics, I guess, in it all, and how we reduce that postcode lottery across the system for people.
Yeah, it's a big challenge, isn't it? It's a big
Yeah.
challenge.
And I think if I was to get any further involved in pharma, I'd probably need to go and do some training around the whole commissioning, governance, etc. Because obviously, as well, when you're in a world where we've got to be very explicit and competitively tender for different people, if the pharma company, if the drug can be provided by more than one pharma company, I don't know all the ins and outs of that, so I'd have to go to my teams to
Yeah,
find that
yeah,
out
yeah,
if
yeah,
I
yeah.
was in that position.
But it's like any external supplier, isn't it? No matter what they're providing, you want that partnership or that relationship to be built on trust, to be built
Yeah,
on certainly in your line of work, to be built on data as well. You need to be
yeah,
looking. I would imagine. Correct me if I'm wrong, but I would imagine you spend quite a bit of time looking at data, looking at stats,
absolutely.
seeing what's happening where, and bringing that together, which is really really key. I would be absolutely lost with that type of
Yeah,
role myself. But that I would that be right? Would you spend a lot of time looking at
yeah,
stats, looking at data, pulling all that together? Is that yeah?
yeah, absolutely. I mean, data and intelligence is fundamentally underpins a public health approach and how we do
Yeah.
our approach, and it being evidence-based. Data comes in many different forms. I personally am not a numbers person. I always find someone who can when it comes to
Mhm.
that. So we have some amazing public health analysts across our system and in places, and also within our system teams as well, that help us do that and help us look at where looking at deprivation deciles, looking at access to services, segmenting the population, using a population health management approach. But then data also comes in people's stories.
Mhm. Mhm.
And that's the bit that that's the bit that interests me the most. So for me, it's about understanding how somebody feels, what their experience has been, what the gaps are, what they need, and then using the numbers to back that up. So I think you've
Yeah.
got to do both. But yeah, everything we do is underpinned by the intelligence.
Yeah. Yeah.
It's not perfect because the intelligence isn't always there.
Yeah, yeah, yeah. It's just having that conversation with the coal face, isn't it? Really,
Yeah,
with people having a bit more of a fluid conversation with people, and getting it from the horse's mouth, so to speak, in terms
yeah,
of what their experience is, as you say, where the gaps are, and then using the data, to help
yeah,
solve that problem. And that's where I know I've said pharma before. I know you necessarily personally don't work directly with pharma, but I think that's a really key lesson for pharma, that we have to work as problem solvers continually, and working with people in public health, and in other roles within the NHS, to say, what's your problem, how can we help you solve this,
yeah.
how can we work with you to make your life easier, and to make
Mm.
the life, ultimately the life of the patient, which is the ultimate goal, so much better.
And I guess I'd be looking at at the value base of companies as well.
Mhm, mhm.
Is the company looking at the whole person, looking at not just the fact that here's a drug, take it, you'll feel better,
Yeah,
um, but looking at actually what else do we need to do in order to do that. Wegovy being the perfect example. It's not a miracle cure, it's not a miracle drug. If we had that, we wouldn't have obesity, we wouldn't have the
yeah.
issue. Um, it's the psychological support and the obesogenic environments that people live in that we also need to consider. So I think for me, I'd be looking at companies that can offer insight into that as well. So it's
Hmm.
not just about them trying to sell a product in form of medication, but actually trying to sell a lifestyle, I suppose, and
Hmm.
how we
Hmm.
can support people in everything that's affecting them and impacting on their choices.
I totally agree with you. I think, again, companies, obviously, in what I do each day from a recruitment perspective, we have to, but we enjoy it. We offer more than just recruiting, or filling a vacancy. We offer a lot more around that whole model that we do
Mhm.
now, which is all around people, helping solve that
Yeah,
wider problem of attracting talent to your organisation. And that's through providing, from our perspective, providing good content that our customers will look at and go, yeah, that can add
mhm,
value to me and my job on a daily basis. And that's exactly the same from what you're looking for from
yeah.
from your
And
supply. Yeah.
I think maybe what understanding the influence that pharma companies might have. We only have so much influence in the roles that we have to impact on government policy
Hmm.
and
Hmm.
changes. And we're in a society now where we're kind of on the edge of a cliff of our own making, and if we don't do something, um,
Yeah.
it's going to be really hard. And the system's not moving along at the same pace as technology is, as people's lives are, etc. And so for me, I'd be really interested in how pharma could help that,
Hmm.
and how big companies like pharma companies can help influence where we struggle.
People need to be a bit bolder, I think,
Mm,
in terms of their ideas. They need to be a bit bolder in terms of the delivery. I think we could probably, certainly in my experience of working in this industry over the years, you can always remember probably just a small group of people who really stand out because their ideas, their way of delivering that idea, and working, again, as I said, in partnership with the NHS, really stood out. It stood out because they
yeah,
came up with something either quite innovative, or something that we've always been doing, but they did it really well,
yeah,
and they made sure that communication was spot on. They made sure that, you know, the delivery of it was spot on. The customer service element of it was really there. But I think that's what people within, you know, our circle, your circle, my circle, in terms of healthcare as a whole, we need bold people,
Yeah.
I think. You know, because you say we're a bit of a cliff edge. There's no doubt about it, and a number of different things. But that's what I think it requires at the moment.
I think in West Yorkshire we are really privileged that we have that senior leadership, that bold senior leadership within our ICB that does allow us to think outside the box. Obviously, you can only do what you can do within the limitations of resource.
But if you've got the space to do that, though, if you've got the space to within that team of people, and if that leadership team is allowing you the space to come up with some wacky ideas, and you probably think that 80% of them they'll look at you and go, no, come on, seriously, we're not doing that. But there'll be that 20% of ideas that will come through, and they'll go,
Yeah,
brilliant. Let's
yeah,
you know, let's see if we can get a bit of traction in that. Let's see if we can try that, and if there's opportunity to do that, where people, a lot of the reasons why I think people move on from companies, especially around about this, is because they are suffocated. They don't get the opportunity to share those ideas, and they're in a very, very tight space, and they feel quite restricted when they can. If you've got the freedom to do that without, you know, feel of kind of ridicule or whatever, then that's a good place to be. They might not all
yeah.
work,
It's a really good
but that's a good
place.
place to be. Really good place to be. So actually, that's good moving on from this. So I mean, there's people watching this just now. It's a similar question asking, certainly in this series, and they're thinking, I'm interested in moving into public health. I'm interested in looking at ICBs. I'm looking at these roles. Now, we look in the NHS website, for example. Well, I don't, because we're not recruiting that space, but there's a load of jobs. There's a ton of jobs, you know, across all different facets. But if somebody's specifically thinking about a job in public health just now, what advice would you offer these people at the moment?
I think we have what we call the wider public health workforce, which is there are many people doing roles that contribute to public health. Firemen, ambulance, teachers, community workers, they're all doing public health roles. So I think it would be look at your own role and what is it that you've been doing within that role. You can go online and you can look at the Public Health Outcome Framework, you can look at the Royal Society of Public Health and the Faculty of Public Health, and you can Google what a public health specialist is. But ultimately, I think you still have to look at what can you do within your own role. If you're wanting to then go on to be a public health specialist, there's lots of different training you can access. So there's a practitioner level training that you can access across Yorkshire and the Humber. There's the trainee course for public health consultant. So it depends on where you are in your career and what experience you have as to which ones of those you would access. We also offer the opportunity across West Yorkshire for we run a fellowship within our programme, and that fellowship, anybody that lives or works in West Yorkshire can apply for it, and it's free for people to join and take part in the fellowship. We just have to have agreement that their organisations will give them the day release, which is just 1 day a week for 12 months. And what they do is they undertake the foundation in public health training as part of that fellowship, which is provided to us by Health Education England and the university. And then we provide them the opportunity to be a health equity fellow or to be an adversity trauma and resilience fellow. We've got suicide prevention, climate change. And in those 12 months, we will pass on all sorts of knowledge and skills around different aspects of public health, but also around the actual topic that they've chosen to look at, and they get a mentor on various different things. So I think there's lots of opportunities. Seek out your local public health team, find out what they do, and then see if it's something that you're interested in. But the likelihood is people that come into this sort of space are already doing that wider public health role.
Yeah. I like the way you put that actually at the start, you know, in terms of what people are doing, that is the kind of maybe don't have the job title that you have, but they're involved in public health, as you say. And I think that's forgotten about.
Absolutely.
And I mean, obviously you've been in this kind of arena for some time. You and I don't know each other that well, but I can see that you obviously we said at the start, you love what you do. You seem to really enjoy what you do. So I can see you being in this type of space for a long, long time, possibly until you retire, dare we say? But you don't need to answer that question for me.
Well, it just depends how old I'm going to be now when I'm allowed to retire. But yeah, for the foreseeable future, I wouldn't see myself moving. I really enjoy what I do and the organisation that I work for.
Good. That's good to hear. Really good to hear. And this has been hugely interesting. As I said, it's a slightly different angle to the podcast that we're taking on this conversation, and that's good. And I'm pleased that you've just taken time to be so open and then share with us, what you do, what you enjoy about it, where the challenges currently lie, which most of us from an outsider's point of view can see it in the media. We can see it all the time. But the really practical advice that you've shared for people who are considering moving into public health, no matter what or how that looks. So thank you so much for your time, Emmerline. It's really, really great to be with you today. And I wish you all the best. So thank you very much.
Thank you.
Take care.